today's class is radiographic landmarks of the maxilla. So coming to the maxillary incisor region, we can see A is a radio opacity, which is seen almost in the midline region of the palatal region. That indicates the nasal septum. And B is a soft tissue radio opacity seen within the nasal cavity, that is the inferior concha. And C is the radiolucency of the nasal cavity. D is a rhomboid-shaped radio opacity, which is seen between the central incisors, slight posteriorly, which is the anterior nasal spine. And E is an oval-shaped radiolucency, that is incisive foramen. F is a thin radiolucent line which is passing between the central incisors, that is the median palatal suture, and G indicates the soft tissue shadow of the nose. So coming to the bone, we can see that in the facial aspect, we can see D is the nasal septum again, C is the nasal cavity, you have the inferior concha as seen as B. And coming to the palatal aspect, F indicates the median palatal suture, and E is the area where it is slightly depressed and which is seen as an oval-shaped radiolucency in the radiograph. Again, this is the detailed aspect of the nasal septum. In the bone, we can see it is a midline radio opacity as seen as in radiograph. Inferior concha again is seen as a radio opacity, a slight radio opacity within the nasal cavity. Again, you can see the nasal fossa seen as a radiolucency on either side, on the both in the left as well as right maxilla. Anterior nasal sign is seen as a V-shaped radio opacity. So between the central incisors in the periapical region, you can see a V-shaped radio opacity or a rhomboid-shaped radio opacity, which indicates the anterior nasal spine. Incisive foramen is seen as an oval-shaped radiolucency. You have the median palatal suture, which is again seen as a thin radiolucent line. Soft tissue shadow of the teeth, nose, which passes between in the middle 1/3 of the teeth. So here in this radiograph, we can see that E is the region where you have the incisive foramen, B is the inferior nasal concha, A is the nasal septum region, and in the red arrow indicates in the first radiograph, it shows that it is a periapical lesion. And here in the second radiograph, the red arrow shows the soft tissue shadow of the nose. And B is the radio opacity of the inferior concha, whereas A is the radio opacity of the nasal septum, and D indicates the anterior nasal spine. Here, in the next slide, you can see that in the red arrow shows the mesoden, which is invertly placed, and there is the presence of the soft tissue shadow indicated by the green arrows. And here in the second radiograph, you can see a periapical lesion associated with the central incisors along with median palatal suture, that is seen as F. And the D indicates the nasal septum. Next, you have the superior foramina of the nasopalatine canals, which is seen bilaterally on either side of the mid-palatal suture. So here, actually, it is a radiolucency which is seen in the center of the palatal region as a radiolucency bordered by a thin radiopaque line, which is the incisive canal cyst. And in the second radiograph, you can see the F again indicates the mid-palatal suture, Then you have a internal resorption, which is seen in the blue arrow. Here in this radiograph, if we see that the red arrow shows the lip line, whereas the green arrow shows the soft tissue shade of the nose. Now coming to the maxillary canine region, you can see that A indicates the floor of the nasal fossa, whereas B shows the floor of the maxillary sinus. Whereas C indicates a lateral fossa, which is almost an oval-shaped radiolucency seen in the lateral aspect of the maxillary canine, and D indicates the soft tissue shade of the nose. Coming to the bone, in the facial aspect, again you can see the lateral fossa is seen as a depressed area in the lateral aspect of the maxillary canine, whereas A indicates the position where you will have the floor of the nasal cavity, and B is the position where we have the floor of the maxillary sinus. So here in the radiograph, you can see A indicates the floor of the nasal cavity, B indicates the floor of the maxillary sinus. When both joints, it is seen as an inverted Y. So coming to again, the floor of the nasal cavity again can be indicated by the red arrow, and whereas the floor of the maxillary sinus is indicated by this blue arrow. Both when they join together forms an inverted Y in the region of the maxillary canine. So here you can detailedly see the radiolucency of the lateral fossa in the lateral aspect of the maxillary canine. Here, the red arrow shows the nasolabial fold, which may be appreciated in certain IOPs. And here you can also see the inverted Y, which is made up of the floor of the nasal cavity as well as the floor of the maxillary sinus. Again, you can see in another slide where you have the maxillary sinus as well as the floor of the nasal cavity. White arrow shows the maxillary sinus, floor of the maxillary sinus, whereas here the red arrow shows the radiolucency of the maxillary sinus, which is extending between the premolars, second premolar as well as the first molar. Here, the red arrow identifies the lateral fossa and the pink arrow points to the chronic periapical periodontitis region. And here you can see it is RCT treated tooth, and you can see a post and core placed in this incisors. So coming to the maxillary premolar region, you have A indicates the malar process, B is the sinus septum, C is the sinus recess, which is seen a radiolucency within the radiolucency, and here D is the maxillary sinus. So we know that the maxillary sinus will be seen as a radiolucency in the periapical region of the maxillary premolar and molar region, and sinus recess is a radiolucency within a radiolucency, which will be more darker within the maxillary sinus, and B indicates the sinus septum, and A the malar process. So coming in the bone, in the facial view, we can see D is the position where you will have the floor of the maxillary sinus, and C is the sinus septum indicate position, and A will be the malar process. And again, C indicates the area of the sinus septum. Again, in the facial view, here you can detailedly see the malar process. If you see the second diagram where you have the radiograph, here the malar process is clearly denoted by the black arrows. Here in this diagram, you can see this is the floor of the maxillary sinus, which is indicated by the black dotted lines, and here with the black arrow shows the sinus septum. And here in this radiograph, you can see the maxillary sinus itself is a radiolucency, and here within the radiolucency, you have again a more blacker radiolucency, which is the sinus septum. Then you have the maxillary sinus, which is again an air-filled cavity, we know that. And here you can clearly see a blood vessel within the maxillary sinus, which is seen in the red arrows. Here, there is a radiopacity within the maxillary sinus that is usually a mucus retention cyst. And you can here in the second radiograph, the red arrow shows the indication of the nasolabial fold. Here this radiograph shows the pneumatization seen with relation to the maxillary sinus, that is the expansion of the sinus wall into the surrounding bone, usually seen in the areas where the teeth has been lost prematurely. And usually here you can always see that the pneumatization of the maxillary sinus increases with age. So coming to the final part, that is in the maxillary molar region, A shows the region of the maxillary tuberosity, whereas B shows the coronoid process. That is the only part of mandible seen in a maxillary radiograph. And C indicates a radiopacity, that is the hamula process. And D indicates the pterygoid plates, which is usually seen distal to the maxillary tuberosity. And F is the maxillary sinus, and E is the zygoma bone. So coming to the bone, you can see again, F indicates the region of the floor of the maxillary sinus. Distally to the maxillary tuberosity, D indicates the pterygoid plates, as well as C indicates the hamula process, B the coronoid process, whereas G may be the sinus recess. So in the radiograph, again, you can appreciate the zygomatic bone, which is seen in the E region, whereas F indicates again the floor of the maxillary sinus. So here the maxillary sinus's tuberosity is seen distally to the maxillary molar region, and it shows a rounded elevation located in the posterior aspect of both the sides of the maxilla. So coronoid process, again, it is seen as a triangular shaped radiopacity, and which is the only part of mandible seen in a maxillary radiograph. Hamula process, again, is seen as an extended radiopacity almost attached to the pterygoid plates, and it is seen attached to the pterygoid plates. Again, the zygomatic bone. Here we can clearly indicate the zygomatic bone in the radiograph. Again, coming to the maxillary sinus in detail, here we can see the floor of the maxillary sinus indicated by the black arrows. Then you have the yellow arrow indicates the sinus septum, and blue arrow indicates the zygomatic process or the mala process, and just below the distally to the maxillary molar, you will have the maxillary tuberosity. So maxillary sinus, again, here there is a slight radiopacity attached to the floor of the maxillary sinus. That is usually a mucus retention cyst associated with the maxillary sinus. In the second radiograph, here you can see a supernumerary tooth. So in this radiograph, the green arrow indicates the mala process. The pink arrow shows the maxillary tuberosity, whereas the orange arrow shows the coronoid process, and the blue arrow indicates the pterygoid plates. And another radiograph where we can clearly see the floor of the maxillary sinus indicated by the red arrows. And here in the second radiograph, here you can see the blue arrow indicates multiple supernumerary tooth. And here you can see the red arrow shows the pneumatization of the maxillary sinus. Okay, this will be the end of the radiographic landmarks of the maxilla. Thank you.